Good afternoon, everyone. Thank you for joining the Foundation for a Healthy Kentucky's Health for a Change webinar, Raise Your Guard Kentucky. I'm Allie Wells, Communications Associate for the Foundation. We have several great panelists with us today. We have LaToya Drake, Program Coordinator for Marketing and Media with the Cooperative Extension Services Nutrition Education Program. We have Dr. Lacretia. She's the Associate Professor in the Department of Counseling and Student Affairs at Western Kentucky University. We have Dr. Robert Carmen, Division Medical Director with U of L Health Sleep Medicine, and Dr. Kathleen Winter, State Epidemiologist and Director with the Kentucky Department for Public Health, Division of Epidemiology and Health Planning. Before we get started, just a little bit of housekeeping. We've enabled the live transcript feature on this webinar, so you can control whether you see that closed captioning by selecting live transcript on the bottom of your screen. We also invite any questions you may have, just type them in the chat box and we'll address them when we get to the Q&A part of this program. First, just want to tell you a little bit about us. The Foundation for a Healthy Kentucky is a nonpartisan, nonprofit organization. We're focused on healthcare access and children's health. Much of what we do is in the policy realm, and that can be on the state level, local level, or even the school or organizational level. Healthy Kentucky has launched a new campaign in partnership with the Kentucky Cabinet for Health and Family Services. It's called Raise Your Guard Kentucky. The campaign is supported by a $1 million grant from the U.S. Centers for Disease and Control Prevention of the U.S. Department of Health and Human Services. So we know that rates of chronic conditions have increased during the pandemic. And we also know that if you have a chronic condition, you are more likely to have serious side effects if you catch COVID-19. So it's really two big negatives that we're trying to tackle. The campaign is all about promoting small steps that Kentuckians can take to improve their overall health and immunity so that they're better able to fend off viruses like COVID-19, as well as those chronic conditions. So these are those healthy habits that we want to see people doing. Eat well, move more, stay up to date on all immunizations, schedule annual checkups and screenings, maintain a healthy weight, drink lots of water, get enough sleep, quit smoking and vaping. If you drink alcohol, drink in moderation, try to minimize stress, and wash your hands. Now we want to dive a little bit deeper into some of those topics. We know that one of the best ways people can protect themselves is by staying up to date on vaccinations. So let's start out with Dr. Kathleen Winter, State Epidemiologist and Director from the Kentucky Department for Public Health. She's going to talk to us about the state of immunizations and vaccine preventable diseases in Kentucky. Dr. Winter.
Great, thank you, Allie. All right, so I think many of us are aware that during the COVID-19 pandemic, unfortunately, well-child visits really got off track. A recent survey that assessed parents during the first year of the pandemic found that over 41% of parents of children who are 12 years of age or younger had missed at least one well-child visit during the first year of the pandemic. This was most common among Hispanic families, and more than 20% of those parents also reported that they never subsequently made up that visit. So those children potentially have missed those opportunities to get vaccination if those were key visits where vaccinations were needed. So how off track are we here in Kentucky in terms of routine immunizations? So we've been looking at this in a few different ways, trying to use the best available data that we have to look at childhood immunizations. So these data come from the Kentucky School Immunization Survey. Every year, the Kentucky Department for Public Health surveys schools to look at coverage rates at a few different checkpoints. And those checkpoints are kindergarten, 7th grade, and 11th grade. So this is looking specifically at the tetanus, diphtheria, and acellular pertussis vaccines, the DTaP or Tdap, depending on the age. So you can see the trends that the vaccines have been dropping in terms of our coverage rate. The Healthy People 2023 goal here is 90% coverage, and we are well below that for 7th grade Tdap. And this is particularly concerning because we have had recent outbreaks of pertussis here in the state. Pertussis is a disease that's still endemic, and it is whooping cough. And we do see cyclic peaks every several years, and we are primed to potentially be leading into a major pertussis epidemic in the coming year or two if we don't really push to get our pertussis vaccine rates up to where we want them to be at that 90% threshold. When we compare how Kentucky is performing against the other states, you can see that we are underperforming in terms of our childhood immunizations. So this is again looking at the kindergarten school assessment survey from last year and comparing what other states have reported for MMR vaccine. Kentucky's showing here with this arrow, our coverage rate is less than 87% among kindergartners who have received 2 doses of MMR vaccine. The Healthy People goal for measles vaccine is 95% due to the fact that it is so infectious. So we're well below both the national average and that Healthy People 2023 goal. And we are unfortunately in probably the lowest 5 states here in terms of MMR coverage. Interestingly, when we look at racial and ethnic differences, and this is data coming from the National Immunization Survey, looking specifically at children who have been vaccinated of certain vaccines by age of 24 months of age. We don't see a clear trend in terms of certain racial or ethnic groups that have lower coverage. When we look at MMR, the tetanus, diphtheria, pertussis vaccine, and polio vaccines. But where we do see clear disparities are amongst our insurance status. So when we look specifically at children who have private insurance compared to those who are covered by Medicaid and those who are uninsured, you can see that coverage is significantly lower among uninsured children and among children who have Medicaid coverage. And that's really across the board for all vaccines. And those that I've highlighted here in red are those that are below the 90% threshold, which is recommended for most vaccines for the Healthy People 2023 goals. HPV vaccine is recommended for both males and females in Kentucky and in the United States. And it's particularly important for Kentucky children because rates of cervical cancer in Kentucky are among the highest in the nation. We have a rate of new cervical cancer diagnoses of 9.2 per 100,000 women here in Kentucky. You can see that is showing here on this map. But in our most recent data from the CDC teen vaccine survey, only 57% of Kentucky teenagers between the ages of 13 and 17 were up to date on their HPV vaccine, and that's below the US average of 62%. And unfortunately, it's even lower among females. So less than 49% of females, Kentucky females of that same age group were up to date. And less than 67% have had even just 1 dose. So they have not even initiated that series at all. When we look at COVID-19 vaccines, Kentucky, this data shows a little bit different because our coverage here is among the lowest. You can see it's here in this lighter shade of green. And this is the population 5 years of age and older who have received a bivalent booster. So this is the population for whom this bivalent booster dose is recommended. So 13% of Kentuckians 5 or older have received the bivalent booster. So we're pretty low on this front, although many Kentuckians have received 1 dose or have been fully vaccinated with the primary series. Those who have gone back to get the booster and ensure they have the best current protection is still lacking. And we know that booster is really needed based on the vaccine effectiveness data that we continue to see nationwide. So this line is showing incidence of pertussis fatalities. This black line is among those who are completely unvaccinated. This blue line shows fatalities among those who have been vaccinated but never received the bivalent booster. And the green line shows fatalities among individuals who have receive that bivalent booster. So the incidence is much lower among those who are fully and currently vaccinated compared to those who are unvaccinated. But where we see the biggest gap in COVID-19 vaccine coverage is again among our pediatric population. So here in Kentucky, 94% of children under the age of 5 have never been vaccinated for COVID-19. And 75% of children in the 5 to 11 year age group have never been vaccinated for COVID-19. So our coverage does increase dramatically with age, and around 1/3 of our older adults have received their bivalent booster, but among our children and younger adults, it ranges between only 3 and 8% have received that bivalent booster, which is really essential for the best protection. So I just wanted to quickly go over what we are still recommending with COVID vaccines and what we expect to be coming here in the future. So COVID vaccines have now been recommended to be incorporated into the routine pediatric immunization schedule, starting at 6 months of age. So it's been a recommendation that children get the COVID vaccine, but now the recommendation is even stronger that this should be routinized into the standard schedule and given during normal pediatric well care visits. COVID-19 vaccines have been added to the Vaccines for Children program, and we expect that commercialization of the COVID-19 vaccines will be coming. So they will no longer, likely later this year, will no longer be government funded, government provided. But this is not directly tied to the end of the public health emergency that is coming in just about a month. So we do expect this to occur, but they're independent. So it will not be on May 11th. It will be probably in the summer or fall that we will see this commercialization occur. We're still awaiting additional guidance in terms of whether there will be a future recommendation for a COVID-19 booster, an additional booster, or an annual COVID-19 vaccination. Those data are still being reviewed, and we will be expecting to see additional guidance on this in the coming months, but at this point in time, we really don't know what to expect. So vaccine hesitancy, of course, is a major concern that has only gotten more heightened during the pandemic and in the advent of the rapid introduction of the COVID vaccines. But one thing to point out here is that vaccine hesitancy is not unique to Kentucky. This is something we are seeing across the nation. And when you look at this map, that is a survey looking specifically at COVID vaccine hesitancy by zip code, you can't even really tell where Kentucky lies on this map. We are blended in with much of the rest of the nation. So this is a universal problem that we all need to work together to continue to combat and to promote good messaging around vaccinations and remove the disinformation as best as we can. So where we're really recommending now is that we head back to the basics with these vaccines. We have kindergarten, childcare, middle and high school vaccine requirements here in this state, but we have not been effectively communicating what those requirements are to parents, and schools have not been enforcing those requirements in recent years due to the pandemic. So our recommendations this year are really to go back to where we were pre-pandemic and making sure parents understand what's required of their children when entering school, and that schools enforce those requirements themselves to ensure that the children who are in their populations are up to date and staying protected. We are, of course, recommending that providers continue to recall their patients and keep them up to date. And then using every opportunity for when a child comes into a healthcare setting to look for opportunities for vaccination and give that strong recommendation. We know that with vaccine hesitancy that it can fluctuate. So it's not always an equal hesitancy across the board at every moment. So there can be moments in time where people are more accepting to vaccines. And so we need to try to reach those patients where they're at during those opportunities. We have a new initiative that was launched in the fall here in Kentucky. We have the public portal for the Kentucky Immunization Registry. So parents are now able to go into the portal and look for the records for their children, and adults, of course, can look for themselves. So one thing that this portal does require is that there is an active phone number that is linked with the individual's account. So if you have trouble accessing this portal or your patients are having trouble accessing this portal, please do contact our help desk and we can help get that information corrected so that it can be accessed easily by the public and those records can be downloaded. All right, thank you so much for your time today, and I look forward to any questions you may have at the end.
Thank you so much, Dr. Winter. That was some great insights. Now we're going to hear about nutrition and how important that is. For that, we have LaToya Drake with us. She's the program coordinator for marketing and media at the Cooperative Extension Service Nutrition Education Program. LaToya.
Hey, like she said, I'm LaToya Drake with Kentucky's Nutrition Education Program, and I'm excited to talk about eating healthy and the basics of eating healthy. Let me get my life together. So Kentucky's Nutrition Education Program its purpose is to educate folks with limited resources, so families with young children and SNAP eligible individuals across Kentucky and all of our neighbors to plan nutritious meals on a limited budget, to acquire safe food handling skills, and to improve food preparation practices and make behavior changes necessary to have a healthy lifestyle. So only about 9% of Kentuckians get the recommended amount of daily fruits and vegetables, and that's about 1 in 10 of us. So it's safe to assume that the majority of us don't eat as a consistently balanced diet. This means we could all stand to eat a little bit healthier. Let's chat a bit about some basic things that we can do to eat healthy. So, a healthy eating pattern. What is a healthy eating pattern? It's an individual's habitual dietary intake and decisions regarding food. So it's our eating habits and the beverages that we drink all the time. And we want to focus our shift to a healthy eating pattern and what that looks like for different folks and ourselves, right? So there are many different ways that you can eat healthy. You can eat healthy in a way that works for you and your family. And eating healthy can fit different tastes and cultures and traditions, and it can be affordable too. So the key to building a healthy eating pattern is choosing what varieties of nutritious foods work for you in your diet, and making these choices a routine and part of your everyday habits. So what we notice about all of these healthy plates on this screen right now, no matter your diet preference, whether it's vegetarian, pescatarian, flexitarian, or others, these plates are colorful. So we want to use what we have access to and we can afford to make the best meals that we can and eat the best that we can. So evidence shows that folks who consume a healthy, balanced diet over a continuous time period are at a reduced risk of developing chronic diseases such as type 2 diabetes, heart disease, hypertension, and high cholesterol. So consuming a healthy diet is going to keep us well over time. So what does that healthy diet look like? What does that pattern look like? It looks different for all of us. And healthy eating is important at every age. You should eat a variety of fruits, vegetables, proteins, grains, and dairy or non-dairy alternatives. So you want to include all different food types in your diet. And one way to do this is to start simple with My Plate. And My Plate is myplate.gov. It's a visual representation of how our plate should look with each meal. So we want to eat a variety of foods and beverages, and it's important that we get those in every day. So we want to choose foods and beverages from each of these food groups, right? Fruits, vegetables, grains, proteins, dairy. And we want to get a mix of each type of food in each food group, depending on what our healthy diet pattern, our healthy eating pattern looks like. So we want to focus on whole fruits when we're eating healthy. We want to include a fruit at breakfast. We can top whole grain cereals with fruit. We can add berries to pancakes. We can mix our dried fruits with oatmeal. You can munch on an apple or a pear or some other whole fruit as a snack. We also want to make sure that we're varying our veggies. So we want to cook a variety of colorful veggies. And when we're cooking veggies, we want to make extra vegetables and save those for a later time or date and add those to a different dish or use them as a side. You can add them to stews or soups or pastas, or you can add them to omelets. Think about cooking a large batch of veggies at the beginning of the week and using this throughout the week to fill up. And also you want to focus on filling up half of your plate with fruits and vegetables at every meal. Eating lots of fruits and vegetables is one of the most important and one of the easiest diet habits that we can start to implement. We also want to vary our protein routines. So next time you have a taco night, try adding a new protein like shrimp, lentils, beans, chicken, beef. Switch it up. Eat a variety of proteins, right? Like lean meat, poultry, eggs, seafood, wild game even, beans, peas, lentils, nuts, seeds, low-fat dairy milk or non-dairy alternatives. Just switch it up. Even try incorporating a meatless Mondays so you can make sure that you're getting a different variety of proteins. So we also want to make half of our grains whole. And we want to add brown rice to stir-fry dishes to do that. And if we combine our favorite veggies with whole grains, that's going to make a really filling and healthy meal. So you want to choose whole grain options rather than those processed or refined grains like whole wheat, or like white bread or pasta or white rice. You want to choose the whole grain options. Also, you want to move to low fat or fat-free dairy milk or yogurt, or lactose-free or non-dairy options. You want to incorporate more of those into your diet and enjoy like a yogurt parfait for breakfast made with low-fat dairy milk or fortified soy milk or coconut milk, and top this with some of that fruit to even get more nutrition. I don't know what this noise is. I'm so sorry, guys. There was a noise outside. So we want to incorporate dairy. We also want to drink. Okay. We also want to drink, eat, and eat less added sugars, saturated fat, and sodium. We want to make water our drink of choice and choose beverages with less sugar or no added sugar. We want to cook at home more often so that we can monitor how much sodium and sugar and fat are in the things that we cook. And we want to limit sweets to weekends and special occasions. We also want to stay away from highly packaged and highly processed foods. We want to pay attention to our food portion sizes and make an eating plan or menu each week before we go grocery shopping. So for more tips, guys, on eating better for less and meal planning, food safety, and nutrition, reach out to your local county extension office. There's extension offices in all 120 counties in Kentucky, and many of them offer free cooking classes and nutrition classes and programs. Just reach out to them, call your extension office in your county and see what they have to offer. And in the meantime, you can also check us out at planeatmove.com and see over 300 budget-friendly healthy recipes. Thank you all.
Thank you so much, LaToya. Now we're going to hear about the importance of sleep when it comes to health. Dr. Robert Carmen is the Division Medical Director at U of L Health Sleep Medicine. He unfortunately could not be here live with us today, but he graciously pre-recorded his presentation for us. So let's watch that now.
Hello, I'm Dr. Robert Carmen, one of the sleep physicians at University of Louisville Healthcare. I want to thank you today for letting me give us this little insight into sleep and sleep medicine and the importance of sleep. I'm sorry I couldn't be with you in person. If you need to have me give any comments or anything, I'm certainly glad to leave a contact number and try to get back to you for specific questions or issues. On today's meeting, we want to go ahead and tell you kind of a lot about sleep in a very short amount of time. I want to let you really know that sleep is a very important and essential body function. You know, we devote about 25 to 40% of our entire life to the physiologic and biologic action of sleeping. The sleeping is actually very active. There's a lot that happens with sleep, and I want you to know that sleep can be used as a superpower. It is something that can really improve our brain's performance, our body performance, as well as our overall health. So I really want us all to give it more importance. Sleep maintains normal biologic and hormonal function. There are some things that go awry when we're not getting enough sleep or if we have a sleep disorder. And sleep is also something that's very important to both body and brain development as we're young and developing, but even kind of more so as we are aging, and when it comes to the brain rejuvenating or rewiring or something called pruning and shearing of some of the brain cells. So it's very important. And then there is no substitute, or there's no shortcut to getting enough sleep. You know, there's just things that we do that undermine sleep and make it worse. But as of currently, we don't have any way to make sleep better. The most we can do is make it less bad. So I want to try to give you some tips and tricks on better sleep. And then again, the number one thing is just knowing how important it is. And so, the question is, why don't we already know that sleep's important? And really because we think that many other things are more important. So our lives are busy, we're doing a lot, we're doing job and life and kids and grandkids, there's a lot that goes on. So we tend to sacrifice something, and that something is typically our sleep time. Okay, so again, sleep is an essential body function. It's a very active physiologic state. The whole brain development maintenance is really a new concept in the last 10 years. And about 4 to 5 years ago, there is a finding that during good deep sleep is the only time that we clear out a waste protein from our brain cells in our brain. Is the only time that's cleared out of our brain. So it's called the glymphatic system, the glial kind of brain system, but lymphatic as far as draining. So glymphatic system drains and washes this protein out of our brain that's a waste protein. When that protein builds up, it can become the plaques and tangles that looks like the plaques and tangles we find with dementia. So we now know that untreated sleep disorders or not getting enough sleep may be a pre-existing reason to get dementia, or why some people get their dementia. So again, sleep's a very important process, and we need to get enough sleep. We know that in the simple learning, or in the act of learning and putting down better memory and consolidating memory, or kind of putting our thoughts of the day in the right place, during deep sleep is where that action actually is reinforced, and where our brain kind of pathways are pruned and sheared to lay those tracks down better, to consolidate learning, to help coordinate the memories and what we've learned during the day. And oddly enough, when we have sleep disorders, we don't lay down those memories correctly or enough. We have poor learning, poor test taking. We actually have more PTSD, which is a manifestation of poor brain resilience. The brain doesn't withstand harm as well, and it lays down memory tracks in an abnormal way that gets imprinted, that comes back to kind of get us in the long run. So sleep's an important function when it comes to some of that memory and recall and learning. It's also important to our bones and our muscle as far as kind of development. And the only time that we really repair and restore is during good deep sleep. Even when it comes to when we work out our bones and muscle, one of the pillars of recovery of athletic or body performance, one of the pillars of recovery is actually sleep. So most of your elite athletes and college athletes know that sleep's important. They need to get enough sleep. They may nap during the day or after a workout to help their bones and more important, the muscle restore or rejuvenate and repair. This is also intensely important for our heart. So during sleep is where our heart relaxes, where blood pressure gets lower, where heart rate is lower, where there's a lot of recovery, rejuvenation, a lot of relaxation, where the heart is really working less hard. Now, when there's fractured sleep or a specific sleep disorder like sleep apnea, which is a pathology, the sleep is full of these awakenings that are stimulated by adrenaline, the fight or flight mechanism from sleep apnea, that drives blood pressure up, that drives the heart rate way too fast, makes the heart go out of rhythm. So the heart can really be this life will be made easier with good sleep, or worse if there's a sleep pathology. And then even when we don't get enough sleep, there's a higher sympathetic nervous tone. So there's actually more hypertension, even without sleep apnea, just with the shortened sleep time. There's more likelihood for cardiac arrhythmias as well. One of the neat findings right before COVID was a study done looking at our immune system in sleep. And it was a in vivo study of studying macrophages, which is one of the immune cells that presents either cancer or infectious agents. That macrophage will gobble up that agent and present it to the rest of the immune system so it can be conquered or eaten up. The macrophage function, from a single night of 5 or less hours of sleep, the macrophage function goes down to 30 to 40% of normal with just a single night of not getting enough sleep, which is incredible. That was not discussed before, it was unknown. We knew that chronic sleep deprivation did a lot to make people have more infections, more cancers, but we had no idea that a single night of 5 or less hours could trigger something like that. So again, sleep's very important. And then our whole endocrine system, whether it's growth hormone or testosterone or some of the other catecholamines or hormonal influences, is actually anchored and guided out of deep level sleep, the delta sleep, stages 3 and 4 sleep. So when it comes to the endocrine system, we need a direct and well anchored sleep cycle to do that. Okay, so we also know that sleep is important for our brain function. So when we don't get enough sleep or we have a sleep disorder, we actually have more cognitive mistakes. We have about a 15 to 20% decrease in our memory, a 15 to 20% decrease in test-taking skills. We've got this decreased whole body and brain performance. We have more on-the-job accidents. We've got more dissatisfied employees when they're having to work hours that's not right or getting poor sleep. We have increased medical disorder and employee illnesses. And on average, with the sleep disorder of sleep apnea, we lose about 12 years of our lifespan from it. And we certainly have increased cost and liabilities. So poor sleep equals poor outcomes from cost, safety. I want to give you the example with the recent change of daylight savings. When we all lost an hour as earlier this month, we lost that hour with the change of daylight savings. And the next 2 days were actually the most dangerous days of our entire year by OSHA-related reporting of on-the-job accidents as well as road safety. The next 2 days following that had a statistically significant increase in lives lost, driving accidents, and OSHA reporting accidents due to, on average, us losing about an hour of sleep on average from the change in timing. Again, we had poor learning and brain development. Mental health is drastically changed when it comes to poor sleep. So we certainly want to improve sleep to help with mental health and improve neurotransmitter balance. There's been data looking at traumatic brain injury and PTSD in the military and the direct relationship with brain resilience and sleep disorders. In the US, the major, most common sleep disorder is not getting enough sleep. So again, I want you to know that sleep's important. I want you to be able to get enough sleep. After that, it's going to be insomnia, and kind of our typical life is filled with insomnia patterns that come and go. But when it comes to chronic insomnia, it's definitely something that we want to address so people can get better sleep. And the answer is not to prescribe a sleep aid. It's to do something called cognitive behavioral therapy. And then we've got about 28 million people in the US with sleep apnea. Obstructive sleep apnea is where we stop breathing during our sleep. Of that 28 million, only 15% are diagnosed and only about half are on appropriate therapy. So we sure want to find them. And then another disorder called shift work syndrome, where we're working at times, our brain and body would rather be asleep. So our brain's not fully awake, our body's not fully awake. We're having more metabolic issues, more diabetes, more hypertension, more depression, more weight gain, and poor job performance. So there's ways to understand and tackle all of those. So again, this is, from a sheer heart perspective, we want to help find and treat sleep disorders. It helps with cardiac stress, hypertension, rhythm disorders, hypertension, diabetes, cholesterol. And there's just a cascading myriad. So a normal sleep cycle is going to sleep, getting to deeper sleep, and cycling kind of with multiple awakenings during the night. And some of the deepest sleep we get is that last couple hours of sleep. So that's important for us to get enough sleep so we get that deep sleep. So I've got some handouts in our presentation about sleep cycles, sleep deprivation, what's normal, what's abnormal. Those are all there for your perusal, and take a look through the presentation. A lot on sleep apnea, what happens when we find it and don't treat it, or when we do treat it, what happens so things improve if we find apnea and treat it effectively. Based on our time together, I want to leave you with our presentation and give you the advice to please share with your patients data on sleep disorders And if you are willing, certainly, or need a resource for it, please send the patients on to your local sleep docs or sleep clinics. Thank you so much for letting me speak.
We are so grateful for Dr. Carmen for being willing to pre-record for us, and I will include his full presentation, all of his slides, when I send out the on-demand version of this webinar, so everyone will get the chance to really look through those. Last but not least, we're going to hear from Dr. Lacretia Dye. Along with her position at WKU, she is a licensed professional clinical counselor, national board certified counselor, and licensed school counselor. Dr. Dye has a passion for integrative health and is going to talk to us today about physical activity and stress. Dr. Dye.
Hello, everyone. I'm excited to be here with you. Let me put my presentation into presentation mode and we'll get started. Beautiful. So stress and movement in the body. I want to first introduce you all with this thought and allow it to sit on you, allow it to flow with you. Without movement, emotion, stress, and trauma can get locked and or blocked in the body. So everybody just think about this. Make this about you. Say, this is about me. Make you the primary subject of this content. What is your movement life like? What is your physical movement life like? Which definitely will influence your emotional movement. As humans, we have stress. So we have these external stressful events. And then there's 3 different types of stress that comes into our body. When we feel distress, we activate emotions. All stress is not created equal. I want to talk about first the 3 different types of typical types of stressors that we can experience and then have that stress within our bodies. So you see here, the first one is an acute stressor. So an acute stressor is just like you see, there's a lion, there's something big that's happening, boom, it hits you, and then it creates this stress within, acute stress within your body. Usually at that moment, our adrenaline shoots up and then we usually take action. We actually were built and created for acute stress. So acute stress is one type of stress. And then you see the drippy faucet, and that is the chronic stress. And this is when our cortisol levels really go up, and it really affects our health when the cortisol levels are so high within our body. Now, the reason why I put the drippy faucet is something that's ongoing. Sometimes there's a drippy faucet and it's continuing and it can start bothering you. So examples of chronic stressors can be things like poverty or racism or just continual things. We all recently, as a globe, the world, we experienced a chronic stressor, which is COVID-19, right? First, we thought it was just coming in as an acute stressor, but it actually turned into a chronic stressor, something that is long going, right, family? And then we have psychological stress. Now, psychological stress as a therapist is probably the hardest one for me to work with. So psychological stress is the stress that is created by the way you think about a situation. So it's a stress that's created, the way that I think about something is creating stress. So these 3 different types of stressors all have an impact on our physical selves. Here is just an image. It's an infrared scanning. Many of you may have seen this before, just checking it out online. And while this is not anything that's absolute or set in stone, here's some possibilities of where we can see emotions show up in our bodies. So just like a stressor can occur to you, and usually stress comes in through our 5 sensory organs. Usually when stress comes in, we need to have a way to get that out, right? And a lot of times we see the energy highest, as this infrared scanning is showing you, we see the energy for these emotions highest in these areas. So this is just a fun thing to look at. Maybe you can check it out. And even if I were to ask you the question, where do you usually feel anger? A lot of people will say they feel it in their stomachs or they feel a high energy in their hands. But just make this about you and just see if you can connect or relate to any of these. So where there is pain, there is no movement. And where there is no movement, there is pain. And I'm talking about 2 things here. I'm talking about physical pain, because usually when our bodies have a physical pain, there's usually a mental, emotional, or a spiritual counterpart. A lot of us just think about a pain. So say my shoulder is hurting, and I just think that it's about, I don't know why I have this pain in my shoulder, but a lot of times there's something that is being blocked. It could be an emotional thing that's being held in my shoulder, or it's something that's just not flowing, whether it be physically, but usually whenever there's a physical pain, there's a mental, emotional, or spiritual counterpart that goes along with that pain. And where there's no pain, where there's pain, there's no movement of energy, or movement of just things, emotions that need to pass along. So emotional inflammation, a lot of us aren't familiar with emotional inflammation, but emotional inflammation can actually create inflammation in our body. So when we have emotional things like stress or extreme stress, chronic stress, or we're dealing with PTSD, or we're dealing with things like just emotional challenges that are on a continuum, when we're dealing with trauma and heavy stressors, it can create emotional inflammation in the body. And emotional inflammation is just as damaging to the body as refined flour. So we all know that refined flour is damaging. And I'm so happy that my sister LaToya was sharing about the things that we eat, because our foods are actually our medicine, right? And high fructose corn syrup or low quality inflammatory junk food, all of those things create inflammation in the body. Emotional trauma, emotional stress can also create inflammation in the body. A lot of people who struggle with weight issues, a lot of times we think that it's always about the food. It's not always about the food. A lot of times when we're under stress, our cortisol levels are high. And when our cortisol levels are high, it's really hard to lose any weight, especially around the middle sections of our body. Now, just looking at movement, here's what I love to celebrate you all. Just getting the awareness and the knowledge of movement. Movement is so critical, because how you move on the outside influences how things are moving on the inside of you. So for example, if I'm an active person, I'm physically active and I'm always moving my body, most likely the things on the inside of me, think about all the systems within your body, all the systems where we think about the cardiovascular system, your muscular system, your skeletal system. Just think about all the systems in your body. When you're physically moving externally, it's allowing for those things to move internally. Also, movement stimulates circulation and purifies us. So it's stimulating the circulation on all levels internally, and it allows for this purification within. So a person who moves heals more quickly than those that do not. So make this about you, family. What is your movement life like? Muscles that move have a circulation rate 200 times more higher than that at rest. So just think about the circulation within your body because you are moving your body. Isn't it exciting to know? And then also we want to look at the other side of that, just a life without movement and the deadly impact of sitting. Unless we are asleep, we as humans are not designed to move. We are not designed to live these sedentary lives where we're seated when we're eating breakfast, we're seated when we're on our way to work, we're seated when we're all day at work. None of this is good for our bodies. So sitting for prolonged periods force our bodies into compromised position, which leads to compromised function. So we all know that just this sedentary life, just in this seat right now, just when I'm here too long, my abdominals are shrinking, my hip flexors are starting to shorten, and my lower back is being affected. So all of us need to make sure that we practice more movement instead of just sitting in our seats all day, whether you're at work or at home or in the car. We need to move more. Movement will make you heal overall, but it's not a time machine that can undo this sedentary lifestyle that we have. And the position we assume for most of the day impacts the way we move for the rest of the day. So that means if you are seated for most of the day, that will impact how you move for the rest of the day. So it's very important that as much as we can get up, we need to get up and move, y'all. So movement and the emotions, I wanted to bring these two together because the breath, our emotions, all of it is connected. There is nothing separate within us. Movement and emotions. So anytime we're moving physically, we're also able to move the emotions within our bodies. It shows the inseparability of our mind and body. So when we're physically moving, we're able to physically move some emotions through us. It helps us find a way to reclaim our bodies when we're able to move our bodies and to be aware of the emotions that we are feeling in our bodies. And our emotions is like a language that communicates with us and between us and the world. So when we're aware of our emotions and we're able to physically move our bodies, it's basically like we're becoming more emotionally intelligent. Is what the mind and the body needs. It brings us back home. So being able to be aware of our emotions, being able to be aware of our breath is absolutely necessary, family. I have a couple more slides for you. So a lot of times when we think about movement, family, we think about physically moving, just physically moving the body. But actually, there's some things that there's some gifts that we innately have within us, some resources within us that can help us also move emotions and to charge us or to discharge us. So here's a list on the left side of things that will charge you and charge your emotions or charge energy within you. Because most of us think that in life, there's just this meaningfulness that we're seeking, but there's also this sense of aliveness that we need, some energy that sometimes we need when we have been in a low place or things aren't going so well. So this charge, and you all can check out that list of all the things that charge us up emotionally. And then there's things that can discharge us emotionally. So it's not just emotionally, it's mentally and physically. We can discharge. Look at that list, family. By just exhaling, it's a discharge. Laughing is a way to discharge. Working or movement, these are all ways to discharge this buildup within your body that can come with some of the stressors in our lives or come with some of the traumatic experiences that we have, right? I want to go to a couple more slides. Oh, here. It's funny because I didn't know I was going to be the last person today that would kind of sum up what everyone is saying. But this is something that I put on the slides a few days ago when I created this, you all. And that's my suggestion, to listen to your doctors, because we all have internal resources within. So here are your doctors, the pharmacy that we have within. We talked about this. We talked about our doctor movement, our doctor exercise, right? And then we've talked about Dr. Sleep. We've talked about Dr. Food, Dr. Nature, and Dr. Stillness. I believe all of these things can bring us back to wholeness and are absolutely necessary in our wellness. I believe these things are our initial, before immunizations. These are our innate immunizations that can keep us well. And family, one last slide for you all. And this is really coming from my heart, and I hope you all hear my heart on this. So I'm speaking to your hearts as I share this. There is no them, it's all us. So finally, if we all take a second to breathe about, feel about our emotional and physical movement, and physical movement, it will give us clarity on the gun violence crisis that we are all experiencing and create reform where we would value lives over profit. And that's something that's absolutely necessary within us. And if it were my position, I would say the licensure for a gun is you need to take 200 to 300 hours of meditation before you can even apply for one, because we know that we are at a state where our minds are not clear because we haven't done anything yet. And I appreciate you all for listening to me today. Thank you so much.
Thank you so much, Dr. Dye. We really appreciate that. And thank you to all of our panelists. We're going to have time in just a few minutes to answer any questions you may have. But first, I want to share some of the resources that are available as part of this campaign to you all. These are just to look at a couple of the graphics, and we've got graphics that are about everything that's been talked about today, from, the sleep, the vaccinations, the eating well, the, focusing on stress and physical activities, plus several others. So everything that's a part of this campaign, you can help us promote. And as you can see, these graphics come in English, Spanish, and Swahili. We wanted to make sure that our message was available to as many Kentuckians as possible. That's also something we kept in mind while putting together our videos for this campaign. You'll see in just a moment, we've gone all over the state to capture Kentuckians who are telling their story of how they take care of their health and why. So let's take a look at those now.
Historically, Kentucky hasn't been known for being a healthy state, whether that be in the stuff we eat or our activity.
Inhale back to center.
How does yoga help that? It's pulling us back to our bodies. It's pulling us back to movement, and it's pulling us back to do it collectively.
I'd rather walk than drive, and it's much healthier and cheaper. So I had just retired from my job. I guess I just really became inactive. My blood pressure started going up, my blood sugar, my A1C. Walking definitely contributed to a healthier me.
I climb because it's a release for me physically and mentally. Clip. I have never once come out to the gorge and been like, why did I come out here today? I wish I hadn't have done that. No, every time I'm come out here, it's like, I should come out more.
Oh, mi naitwa Ramazani Kilozo, natokea Kongo. Napenda Kentucky sana. Kipindi nilifika Kentucky, sikuamua nihame tena state, nikabidi nikae hapa na nazidi kuipenda sana. Sisi chakula vya makopo vinatuuzi sana, sio Afrika. Inatakiwa watu kabisa wakwa kamata ile chakula ya kwetu, wanatumia chakula kwetu, inaleta afya nzuri. Juu ile chakula ya kwetu haina madawa.
At 25, got word that my blood pressure was alarmingly high. I started running, drastically improved my health. Bowling Green, Kentucky has so many great places to run. College Street, that is a serious hill. I love it because it makes us stronger. Running has greatly increased my health, my confidence. It's also helped me find my place in the world.
So those were just a few examples of some of the videos we had. There is also videos featuring an urban gardener who's from Louisville. And in a few days, we will also be adding some videos featuring someone from Caldwell County, that's in Western Kentucky, as well as some videos in Spanish. I'm going to put a link in the chat right now to the campaign webpage. That's where you'll be able to download any of these graphics or videos. And we want you to use these in any way that seems appropriate. They can be used on your social medias, in your newsletters. You work in a medical office, you can play them in your waiting rooms. We need your all's help to get this message to as many Kentuckians as possible. So now we have time for questions. I'm going to go and grab that link right now and put it in the chat while I am looking for questions. Let's see here. So there's that link. And not seeing any questions yet. If you've got them, feel free to put them in the chat. Okay, if there are no questions, it's great. It means we answered everything. Kidding. Thank you again to all of our panelists for sharing their time and expertise with us. And thank you to everyone who joined to listen in. Like I said, this will be available on demand, so I'll be sending that out along with links and any presentations and, you know, everything that's available with this campaign. So feel free to share any of that with anyone in your networks. And with that, I hope everyone has a great rest of their afternoon.